Welcome to the Clear Ground Show. I'm your host, Dr. G, with a PhD. Before we get started, remember guys, tell your friends about this show, and please like and subscribe on this episode. It really helps with the YouTube algorithms. If you like the thumbnail art, you can check it out on a much higher resolution on Instagram. And remember, leave any questions you might have throughout the week. And on the last episode of the week, I will be answering the questions in a mailbag. On today's episode, we're going to talk about Quebec taxing the unvaccinated and Canada spying on their citizens. What? Then we'll talk about Joy Reid and how she has similar ideas on what we should do with American citizens who are unvaccinated. Joe Biden sounds off on social media about social media, trying to get them to, break down the misinformation. The Supreme Court says no to OSHA, but yes to CMS on vaccine mandates, COVID vaccine mandates, that is. Once again, the media attacks Joe Rogan as well as a few doctors. And then we're going to get into a heavy topic on vaccination and menstruation and how that whole thing started in the summer and where it's come to in January and what we can learn from it. So all that and much, much more in today's episode. Let's dive on in. So let's look at Canada. This comes from the BBC. COVID, Quebec to impose health tax on the unvaccinated Canadians. Quebec, which has seen the highest number of COVID-related deaths in Canada, is currently struggling with a surge in cases. On Tuesday, the Premier announced that it would be the first in the nation to financially penalize the unvaccinated. Only about 12.8% of Quebec residents are not vaccinated, but they make up nearly one-third of all hospital cases. According to federal data, just over 85% of Quebec residents had received at least one vaccine dose by the 1st of January. The fee has not yet been decided, but will be, quote, significant, end quote, he said. I think right now it's a question of fairness for the 90% of the population who made some sacrifices, Mr. Legault said. I think we owe them this kind of measure. Last week, the province announced that it would require proof of vaccination to shop in government cannabis and liquor stores. A curfew is also in place, the second one of the pandemic, and it runs from 10 p.m. to 5 a.m. each day. On Tuesday, Quebec's death toll from COVID reached 12,028. This comes after 62 deaths were recorded in the previous 24-hour period. The daily figure represented a similar rate to January of 2021, before widespread vaccinations had begun in the province. The percentage of COVID patients in intensive care who have not been vaccinated is 45%, provincial data shows. While rare, Quebec is not the only region in the world seeking to impose a financial penalty on those unwilling to get jabbed. Starting later this month, Greeks over age 60 are being required to pay €100, a fine for each month that they remain unvaccinated. Singapore has required COVID patients to pay for their own medical bills if they are not vaccinated. So I want to break down a few things I just read from the BBC. The first one is this coyly written 12.8% of Quebec residents are not vaccinated, but they make up nearly a third of all hospital cases. Hard to tell if they're talking about COVID cases or just hospitalizations in general, but say they were talking specifically about COVID cases. So that means that nearly or more than 2/3 of the other cases are in the vaccinated, but that also means that if 85% of residents have received at least one dose of the vaccine and 12.8% are not vaccinated, that means the 12.8% are punching a little bit above their weight in terms of hospitalization. But again, it says nearly a third. I don't know what nearly means, but most certainly means that at least over 2/3 are not in that category. On to the second section that I read. So the first thing that stands out to me is that they're requiring proof of vaccination to shop in cannabis and liquor stores, like specifically. I don't know, maybe the virus just works more intensely in cannabis and liquor stores, but the level of specificity in that sentence really, or in that, in this new regulation really strikes me as being odd. Then they mentioned that 62 deaths were recorded in the previous 24-hour period, and the daily figure is representing a similar rate to January of 2021, before widespread vaccinations had begun in the province. Now, in this particular setup, they do not specify the 62 deaths, their vaccination status. Seeing as this whole paper is about a new fee on the unvaccinated, you'd think that that'd be a really relevant piece of information for the BBC to put in this article. Finally, they make a point that there's 45% of the patients in the ICU with COVID are not vaccinated, which means that 55% are vaccinated. Now, of course, again, that means the unvaccinated are punching above their weight class in terms of who's making up percentages of the ICU and who isn't. Also interesting here, they don't give exact numbers. So say it was, there's 100 people in the ICU and 45 were unvaccinated and 55 were vaccinated. I don't know the numbers, but those are relevant. If it was just 10 people that are in the ICU and 4 are not vaxxed and, about 6 are vaxxed, well, that's relevant too, because that means that not many people are going to the ICU. So it's just interesting that they left the numbers out and just put the percentages in this part of the paper. And if that wasn't bad enough, oh yeah, Canada was spying on their citizens without any warrant or any consent during the COVID pandemic with their cell phones. Let's take a listen.
The Public Health Agency of Canada confirmed media reports just before Christmas that it had secretly accessed location data for 33 million mobile devices to monitor the movement of Canadians during COVID-19. That number represents roughly 87% of the population who were spied on without any knowledge that the government was accessing their data. Public Health Agency of Canada officials were forced to admit this had occurred after a request for proposal was published with a call for interest in continuing a program of collecting data for up to 5 more years.
Well, that's just terrifying. But if you guys think none of this can happen in the U.S., well, let's look at a media pundit, Joy Reid, who is specifically calling for several policies like this to happen in the U.S., especially to the unvaccinated.
Let's talk about what other countries are doing, because at some point, I feel like people who are willfully unvaccinated, fine, don't get vaccinated. But they need to start to pay a little bit more of the cost of what this is doing to our system. There are fines that are levied in places like Germany. Germany has stopped paying for the tests, the virus tests for people who choose to be unvaccinated. They've ended quarantine pay for those without vaccinations. IKEA, the company, is slashing sick pay for unvaccinated UK workers. If you are a smoker, insurance companies can charge you more. They can charge you a premium of up to 50%, and you have to put that on the form when you apply for insurance. At some point, don't we have to make people who are just saying, I'm willing to take the risk to be unvaccinated, take the risk for me and take the risk for everyone I come in contact with? Shouldn't they have to pay more into the system because they are collapsing our health system? They're the ones in the ERs. They're taking it up. If you have a stroke or you have a heart attack, you can't get in the ER because they're taking up all the beds. So shouldn't they have to pay more?
So first of all, I think the other lady is wearing a Fauci shirt, which is just amazing to me. But, secondly, the ideas are here. They're here and they're spreading in the mainstream, and there should be some rigorous debate, especially on the implications of passing such legislation against the unvaccinated in this particular case, and consistency. Why don't we do it to a lot of other things that are taking up a lot of hospital beds in general that could be preventable? I'm not saying silence Joe Reid. I'm saying let's duke it out on the field of ideas. Let's debate. So not just Joy Reid, but also Joe Biden at a press conference recently made a specific appeal to social media companies. Let's take a listen.
Unfortunately, while the military is stepping up, as they always do, there are others sitting on the sidelines, and we're standing in the way. If you haven't gotten vaccinated, do it. Personal choice impacts us all, our hospitals, our countries. I make a special appeal to social media companies and media outlets. Please deal with the misinformation and disinformation that's on your shows. It has to stop. COVID-19 is one of the most formidable enemies America has ever faced. We've got to work together.
We've got to work together, not against each other. And I'm going to silence everyone that disagrees with me. And by me, I'm just making a plea to the guys that can actually do it. So please, guys, please silence everyone that doesn't agree with what we're saying today. But when we say what they were saying, what we're silencing them for today, when we say that 4 months from now, it's totally fair. Do not silence us. Just remember, only silence them. This has been a particularly rough week for Biden. So not only in the Supreme Court, which we'll talk about in 1 second, but in his polling numbers. So according to Quinnipiac, Joe Biden's job approval polling has dropped down to 33%, which is very low. That same week, which was last week, the Supreme Court came out in a ruling against Biden's OSHA mandate, meaning OSHA cannot mandate companies with over 100 employees to get the COVID vaccine. So we were talking about how this was not particularly constitutional back in November and October when the different circuit appeal courts were either holding it up or letting it go and holding it up and letting it go, and there's this back and forth. The whole time it was not constitutional, and they knew it, and we knew it on this show, and we've been talking about it. So that's great news. But in surprising news, the Supreme Court allowed for CMS, the CMS vax mandate, to go through. Now remember, CMS, which is the Centers for Medicare and Medicaid Services, was sued similar to OSHA by the states. But let's go through some of the reasonings. It's a little bit of a long legal document, The source, remember, is in the description, so if you guys want to go read it yourselves, you can. I'm going to highlight a couple of parts that really stood out to me, and it's just a few, about the reasoning behind why we need to mandate this for healthcare workers. So first off, a bit of the requirements and what happens if you don't comply. The rule requires providers to offer medical and religious exemptions, that's to the COVID-19 vaccine, and does not cover staff who telework full-time. A facility's failure to comply may lead to monetary penalties, denial of payment for new admissions, and ultimately termination of participation in the programs. So if you don't comply with getting the COVID-19 vaccination, your hospital could not get funding from CMS. So now we're going to get to a couple of the reasons why the health secretary wants to mandate these vaccines. So in this first part, I'm quoting now, in many facilities, 35% or more of staff remain unvaccinated, and those staff, the secretary explained, pose a serious threat to the health and safety of patients. That determination was based on data showing that the COVID-19 virus can spread rapidly among healthcare workers and from them to patients, and that such spread is more likely when healthcare workers are unvaccinated. Now, we've gone through a lot of this in the show, and that is most certainly not the case with Omicron, it would seem. But continuing on, he also explained that because Medicare and Medicaid patients are often elderly, disabled, or otherwise in poor health, transmission of COVID-19 to such patients is particularly dangerous. In addition to the threat posed by facility transmission itself, the secretary also found that fear of exposure to the virus from unvaccinated healthcare staff can lead patients to themselves forego seeking medically necessary care, creating a further risk to patient health and safety. He further noted that staffing shortages caused by COVID-19 related exposures or illness has disrupted patient care. So that's incredible. He's saying that patients that somehow know if your doctor is vaccinated or not, that knowing that knowledge, and again, I have no idea how they would know, is making them not go get health care. That is not a reason for someone to get vaccinated. Because someone doesn't want to go see you because of something you have isn't a reason for you to get vaccinated. But furthermore, he admits that staffing shortages caused by COVID-19 related exposure or illness have disrupted patient care. Well, that's partially true. What's way more true is the staffing shortages that were artificially imposed because of people that weren't vaccinated is severely impacting the U.S. right now. We did a story about it earlier in the week with San Francisco. That's happening all across the U.S. And that's exactly why now many hospitals are actually, like San Francisco, are bringing healthcare providers back onto the scene, even if they're testing positive with COVID and if they're vaccinated. That means, again, that they can transmit the disease in the hospital, right? So the hospitals are now saying, well, look, we want you guys to only work with COVID patients. As if the COVID-19 is thinking, yeah, well, gee, I can't leave this room. I'm constricted to the same rules that this hospital is constricting this healthcare provider. No, it doesn't work that way. So that what this whole ruling means is that approximately 10 million healthcare providers and workers are impacted by CMS, right? So many of them who don't want to get vaccinated ostensibly are going to be fired. So that means we're going to have another shortage of healthcare workers. All this is going to do is impact patients negatively. That's the whole bottom line of this. And I sincerely hope, and I think is already the case, people are fighting this again, and it should be fought again. We've seen time after time, we saw the Pfizer CEO talking about it. We've seen the data. Omicron is not being slowed down or stymied at all by vaccination. So what's the point? What's the point of vaccinating these doctors or forcing vaccination for these doctors to work in these settings? In totally unsurprising news, the media hates Joe Rogan. So this comes from Mediaite, and the title is Hundreds of Doctors Demand Spotify Implement a COVID-19 Misinformation Policy Due to Joe Rogan's Podcast. So 270, quote, scientists, medical professionals, professors, and science communicators are requesting Spotify add a misinformation policy for its platform due to Joe Rogan's massively popular podcast, The Joe Rogan Experience. The open letter to Spotify calling for action against Rogan came as a result of Rogan's interview with Dr. Robert Malone, which we played part of it here. The Malone episode has been called out for promoting conspiracy theories regarding the COVID-19 pandemic. Let's read part of that letter. So the letter opens up by saying, on December 31st, 2021, the Joe Rogan Experience, which is a Spotify exclusive podcast, uploaded a highly controversial episode featuring guest Dr. Robert Malone. A little later on in that paragraph, by allowing the propagation of false and societally harmful assertions, Spotify is enabling its hosted media to damage public trust in scientific research and sow doubt in the credibility of data-driven guidance offered by medical professionals. If you were wondering if the letter had examples, yes they do, and let's read them. So he is provoking distrust in science and medicine by doing the following. He has discouraged vaccination in young people and children, incorrectly claimed that mRNA vaccines are, quote, gene therapy, end quote, promoted off-label use of ivermectin to treat COVID-19, contrary to FDA warnings, and spread a number of unsubstantiated conspiracy theories. In episode 1757, Rogan hosted Dr. Robert Malone, who was suspended from Twitter for spreading misinformation about COVID-19. Dr. Malone used the Joe Rogan Experience platform to further promote numerous baseless claims, including several falsehoods about COVID-19 vaccines and an unfounded theory that societal leaders have hypnotized the public. Many of these statements have already been discredited. Notably, Dr. Malone is one of the 2 recent Joe Rogan Experience guests who has compared pandemic policies to the Holocaust. These actions are not only objectionable and offensive, but also medically and culturally dangerous. So we've broken down a lot of those claims and statements on this show, but again, like I did a few episodes ago, I really recommend everyone here, if they have the time, to go watch that interview. I think it's really enlightening, and I think at the very least, it'll expose you to ideas that you can go look up for yourself and see if they're true or not. But finally, the letter ends with this. This is not only a scientific or medical concern, it is a sociological issue of devastating proportions, and Spotify is responsible for allowing this activity to thrive on its platform. We, the undersigned doctors, nurses, scientists, and educators, thus call on Spotify to immediately establish a clear and public policy to moderate misinformation on its platform. This, again, is really ugly stuff, but it's not isolated to just this letter. Let's take a look at what CNN has to say on Joe Rogan.
You know, I think at the very minimum, it would be warning signs and banners that would be issued on particular episodes or on shows in particular that were kind of repeated offenders of that, of that infringement on that policy. It would be directing people to credible sources like the CDC or WHO on vaccine-related information or other sources of evidence, since there seems to be just a ton of speculation that ends up happening on these shows, and people take it as infallible. People take it as somehow the other side of science, when really there's a ton of consensus here to prove that what that information is actually incorrect. So at the minimum, it would be banners and warnings.
Yeah. And Joe Rogan...
I'm not entirely sure if Jessica Malate Rivera has a leg to stand on in terms of credibility when the policies from a lot of these places have changed so rapidly and so without particular basis that it seems almost contradictory. From masks to no masks to cloth masks to why the boosters, why not the boosters, to the vaccine escape of the Omicron. All these things are changing so fast, it's hard for them to be, I think, particularly credible, and those opposing voices not credible. I think that you should listen to both and look at the evidence. I don't think, as you guys know, you should silence people. But speaking of credibility and, who to listen to, who not to listen to, let's take a look at vaccine and some of the adverse side effects that we've seen so far. So this title popped up recently in Health, and the title says, COVID-19 vaccine may change your menstrual cycle. Here's what you know. The subtitle says a new study confirms anecdotal evidence from menstruating people, so women, by Elizabeth Narins, January 7th, 2022. So why is this important? Well, changes to menstruation in general can be red flags for lots of things. I'm not saying it doesn't happen just normally. It may, but that's a really big indicator, especially because women are born with all of their eggs. They don't make new eggs like men make sperm. And so it's really important to monitor your health in that regard. And one of the ways to do that is menstruation. And so when there's variation, that can be a sign of some adverse health occurrence. So it should be investigated. But let's see how these anecdotes were handled in the spring and the summer of 2021 when vaccines were being rolled out. From The Brink, do COVID vaccines affect menstruation? Some women say their periods changed after getting vaccinated. Now Boston University researcher is on the hunt for a possible link. And so they cite that some women across the U.S. have anecdotally reported after receiving their coronavirus vaccines, they experienced heavier, earlier, and more painful periods. So now Boston's investigating. So their team was looking to evaluate SARS-CoV-2 vaccination and changes in menstruation during 6 cycles to follow up. And they used data from a bunch of women. And they're hoping that this data is eventually going to be released probably in spring of this year. My only question is, how exactly did we not have any kind of indication of this data before giving this to people? That is just insane to me. But let's go over a few more examples. Here's Huffington Post on May 3rd, 2021. And the original was April 27th of that year. How the COVID-19 vaccine may affect your period and what to do about it. Some people reported changes in their menstrual cycle after the coronavirus shots. Here's why and how to deal. So the article opens up by saying recently some vaccinated people reported late menstrual cycles and heavy periods. The initial vaccine trials did not track data on menstruation symptoms. So here's a quote from Danielle Jones. Unfortunately, these period symptoms weren't recorded during the vaccine trials, so we rely on post-release reporting to get that information. Incredible. This is incredible. The next section of the article, a highlighted area, said the COVID-19 vaccine should not permanently change or alter your menstrual cycle. If your symptoms last for more than a few cycles, talk to your healthcare provider. They just said they had no data on this. How do they know that? There clearly is no lab data to indicate this, so they're just saying this. Shortly after, the article admits again, currently there is no research that links heavy, irregular, and painful periods to coronavirus vaccines. Experts say it's hard to pinpoint what exactly causes these symptoms. Menstruation is a complex process, which can be influenced by many factors, such as environmental changes, stress, sleep, and some medications, Jones said. All of that is true, and it's also true there's no research. So how are they speaking? They're just speaking out of both sides of their mouths in this article. Finally, the article says to report your vaccine period symptoms to VAERS, the Vaccine Adverse Event Reporting System. Now, I was going to do a big section on that today, but I'll get to it on Monday because that's a whole nother can of worms that we need to open and talk about. But let's go to one more article talking about COVID vaccination, and changes in menstruation. Does the COVID-19 vaccine affect your menstrual cycle? Here's what experts say, May 12, 2021. And this is from Women's Health magazine. A colleague told me she has heard from others that their periods were heavy post-vax. I'm curious whether other menstruators have noticed changes too. She asked in February via a tweet. A month before launching her survey, I'm a week and a half out from dose 1 of Moderna, got my period maybe a day or so early, and I'm gushing like I'm in my 20s again. Her original tweet has been shared almost 1,000 times, with people replying with their post-vax menstrual changes, like postmenopausal bleeding and early periods starting days after the shot. In the article, Dr. Margaret Polanski, who's a gynecologist, says, the data that's out there that I've seen is anecdotal and none of it is controlling for women who have not gotten the vaccine. There are very few conclusions we can make based on self-reports other than to say it's something we should look into more closely. So these are high-profile magazines all saying the same thing. We don't know, but, we don't know, so we can't say if it's bad or good. That is such a wrong take on it, but it wasn't just magazines. Look at the media here.
We're going to turn now to our Dr. Jen Ashton, who has some answers to some of your more pressing medical questions. We'll start with the first one, Dr. Jen. Is there a relationship between the vaccines and menstrual cycles? We've definitely talked about this.
We sure have, you guys, and this is really spreading like wildfire on social media with zero scientific or medical basis for this. Remember, in medicine, every time we talk about a study, a finding, what is the first thing we say? Big difference between association and causation. So yes, women can get the vaccine and then experience changes in their menstrual cycle. That does not mean that one causes the other. And in fact, if you look at the biology of how these vaccines work, there is zero hormonal interaction. So please, let's put that to rest.
Yes, this got a lot of attention because a school actually in Florida was telling teachers,
yeah,
they cited this as a reason for not being vaccinated.
Defies science. So
always good to repeat. Thank you.
How does she know it defies science? There are no studies. So this made it all the way to Good Morning America. So a lot of women are coming out and saying, hey, this is my experience with it, all getting shot down. And then what happens? This January. So here's an example from that paper, but it's in the link. You guys can read more if you want. It says this: according to a study funded by the National Institute of Health, individuals who received one dose of a COVID-19 vaccine saw about a 1-day increase in the length of their menstrual cycle. This showed up as a longer time between periods, with periods showing up about 1 day late on average. For people who received 2 doses of an mRNA COVID-19 vaccine in the same cycle, periods were delayed up to 2 days, study authors said. And I mean, what? It's just fertility, guys. It's just fertility. So look, the thing is, I'm not saying any of this to scare anyone. What I'm saying is the credibility is not there. They don't have credibility, okay? At the very least, they have the same credibility as many others that are opposing them because this science is changing so fast. It's just unthinkable to me that a drug with so little known about any of its adverse side effects, from fertility to heart issues to whatever, that they just rolled it out. That's just insane to me as a toxicologist. But that's what it is. And so I say this mostly to help you guys make informed decisions. Do I think people should be able to get the shot? Yes. If you want to get the shot and you know all there is to know about it and you weigh the risks, you should get it. But how can you possibly weigh the risks when we know very few of the risks? And furthermore, they weren't presented to us in that way, right? It was presented to the population as, take this, it's fine. It got to the point of minimizing people's stories on their reaction to the vaccine in order to make more people comfortable with taking it. What should have happened instead, of course, was they should have said, we're going to try to address these. This might cause hesitation, and it should. Once we address them, then we'll give you guys what we know at the time. It should not have been handled the way it was, and the fact that it was means that they have less credibility. That's the whole point of this. I want you guys to make as informed decisions as possible. There is no wrong answer on this. It's just, what's your risk assessment? And the best way to make the best risk assessment is to know as much as possible. Now, speaking of getting close to the truth, and as close as possible, we're going to get to the mailbag, where it is the ultimate truth because, well, I'm answering it. So let's take a look at what a question from the mailbag has to say. This comes from the professor. Serious question. Is CNN trying to be wrong as much as possible? Thank you for the question, Professor. And it's a tough question. So I have a couple of thoughts on this. Number one, CNN claims to be the most trusted news network on television. That doesn't mean they're the most trustworthy news network. That just means what they're saying is they believe that most people trust them. I think it all comes down to the dollar, honestly. CNN has gotten so much wrong about COVID. And we've been tracking it if you guys have been following the show. And now all of a sudden, just this past week, they've done a 180 on everything. I think it's predominantly about ratings and what's popular right now, unfortunately. And so that means they're not really beholden to the truth so much as they are beholden to their ratings. And in that regard, that doesn't mean they have to tell the truth, and they clearly haven't told the truth in many cases. So that's my thoughts on that. I don't know if that answers the question. I don't know if they're trying to be wrong as much as they're trying to get views. And that's what it boils down to, unfortunately. Thank you for the question, Professor. And remember, guys, if you have any more questions, I'll do a mailbag at the end of each week. So I'll just look at all the week's questions and pick a few and put them up here and tell you guys what I think about them. And with that, we're going to end the show. Have a great long weekend. I'll be back on Martin Luther King Day for a quick episode. Enjoy this video. See you guys on Monday.